Before we begin, let's look at definitions. Okay, as you know, chronic hypertension is basically hypertension that may not be related to the pregnancy. So it may be hypertension that existed before the pregnancy, or at the booking visit she was on antihypertensives prior to pregnancy. Anything that occurs before 20 weeks of pregnancy is likely to be chronic hypertension. That is basically hypertension that is not related to pregnancy per se. It may be usually essential hypertension, which is also called primary, or it could be secondary to a particular cause like your renal problem, etc. All right. So normally less than 20 weeks, what we expect in a normal pregnancy is a dip in BP. So the systolic as well as diastolic BP is low in less than 20 weeks of pregnancy physiologically. As we proceed further in the pregnancy, the volume increases, and that is why the blood pressure also increases. While at 20 weeks, less than 20 weeks, there is peripheral vasodilatation because of progesterone that decreases the mean pressure, and the diastolic pressure is decreased. All right. At the same time, the blood volume is not reached the maximum capacity. And that is why you expect a dip in blood pressure less than 20 weeks. However, the very fact that there is increased blood pressure less than 20 weeks implies that there is an underlying cause for the high blood pressure. That is, it may be a cause unrelated to the pregnancy, which is basically essential hypertension or hypertension because of another medical cause. So that's chronic hypertension. So anything less than 20 weeks with high blood pressure is chronic hypertension. Gestational hypertension, just like we have gestational diabetes, it has the word gestational in it. That means it is related to pregnancy. So when you have new hypertension, hypertension is basically blood pressure more than 140 by 90. So new hypertension that starts after 20 weeks of pregnancy without significant proteinuria is gestational hypertension. We would be looking at what is significant proteinuria. So here, when you have high blood pressure, but there is no proteinuria or no significant proteinuria, after 20 weeks of pregnancy, that would be gestational hypertension. All right. Now, the next is, and this is important, an important obstetric complication. So you have preeclampsia. What is preeclampsia? Preeclampsia is basically new onset hypertension. That is, it was not there prior to 20 weeks of pregnancy, and now you have hypertension. New onset hypertension, that is over 140 by 90 after 20 weeks. This is first point, new onset hypertension after 20 weeks of pregnancy, along with one of the following new onset conditions. These are new onset. The word here, which is important here, is new onset conditions. So if it is more than 20 weeks of pregnancy and it is new hypertension along with one of the following. That is, earlier we considered preeclampsia if the definition, if it just satisfied the requirement of high blood pressure with proteinuria. Okay, but now proteinuria is not an essential requirement to diagnose preeclampsia. Can you see this over here? That means it can be hypertension associated with either proteinuria, and what is significant proteinuria is urine to protein creatinine ratio of 30 milligram per millimole or more, or albumin to creatinine ratio of 8 milligram per millimole or more, or at least 1 gram per liter on dipstick. Okay, so these figures are important. What is significant proteinuria? Wherein you have urine protein to creatinine ratio of 30 milligram per millimole or more, albumin to creatinine of 8 milligram per millimole or more, or at least in a liter of urine, there should be at least 1 gram, that is 2 plus on dipstick or more. So these three, one of these three proteinuria criteria would be significant. Okay, so you have new onset hypertension after 20 weeks with either proteinuria, which is significant, or other maternal organ dysfunction, like you could have renal insufficiency, wherein you have creatinine 90 micromole per liter or more than 1.02 milligram percent or more. Liver involvement, wherein you have elevated transaminases, alanine aminotransferase or aspartate aminotransferase over 40 international units. In pregnancy, remember, because of hemodilution, normally SGOT and SGPT or alanine aminotransferase and aspartate aminotransferase are lower. So if it is more than 40, then it may be considered as abnormal. It can be associated with right upper quadrant pain or epigastric pain. Neurological complications such as eclampsia, altered mental status, blindness, stroke, clonus, severe headache, or persistent visual scotoma. So any of these symptoms is also suggestive of preeclampsia. Hematological complications such as thrombocytopenia or DIC or hemolysis. So these are again components of preeclampsia. Another criteria is uteroplacental dysfunction, such as fetal growth restriction, abnormal umbilical artery Doppler, or stillbirth. So this is evidence of uteroplacental insufficiency. Let me give you an example now. If there is a primi gravida who is 19-year-old primi gravida who has come to you at 35 weeks of pregnancy, her blood pressure is 35 weeks, so blood pressure is 150/90. There is hypertension. Her urine protein dipstick is 1 plus or nil. Say nil. Urine dipstick is nil, and she has a fetal weight. Ultrasound is done, and the fetal weight is 1.8 kg, and there is evidence of increased resistance in umbilical artery. What would the diagnosis be?
Is it preeclampsia?
Is there anything else that you would like to know here? Is there a differential?
Hypertension.
Sorry?
Hypertension. Gestational
Chronic
hypertension.
hypertension.
Gestational hypertension.
Why do you say gestational hypertension, dear?
Madam, because there is no proteinuria and the patient is having blood pressure 150/90.
Okay. What did we discuss about preeclampsia?
If there is proteinuria after 20 weeks along with hypertension, blood pressure 140/90, then we can diagnose this as
Is that the definition of preeclampsia?
No, proteinuria or
proteinuria.
Is it a must
may or may
criteria?
not be there.
Yeah.
Yes, Dr. Prabhati. Is it an essential criteria, proteinuria, for preeclampsia?
The urine protein creatinine ratio should be 30 or more, or the albumin creatinine ratio should be that can
Okay,
be taken
okay.
into consideration.
In that case, I would like to repeat once again. Please note that preeclampsia is defined when hypertension is identified after 20 weeks of pregnancy and the coexistence of one or more of the following new onset conditions. What does that mean, Dr. Prabhati?
There is chronic headache, if there is proteinuria, if there is the urine protein creatinine
One
ratio.
or more. One or more.
Yes,
So
yes.
if this does not exist, proteinuria does not exist,
Okay.
but the other criteria exist, like she may be having uteroplacental insufficiency,
Yeah.
IUGR, growth restriction, or she may be having abnormal liver enzymes.
Yeah. Okay.
Okay, so is proteinuria an essential criteria for preeclampsia?
No, no, no.
Exactly. That is why this particular word here, or, is important. So it is not an essential criteria any longer. Earlier it was an essential criteria. Now, if there is hypertension after 20 weeks of pregnancy with either, number one, new onset proteinuria. Okay. Number two, maternal organ dysfunction, which is could be renal insufficiency, liver involvement, neurological complications, hematological complications. Number three, uteroplacental dysfunction. Any one of these three is again new onset, should be there for you to diagnose preeclampsia. So the example that I mentioned here, 35 weeker with
Then it's a preeclampsia.
150/90 and her proteins are nil and her baby is 1.8 kg and there is increased resistance to flow in umbilical artery. What is this?
This is preeclampsia.
Are you sure?
Yes, ma'am. Now it's good.
Everyone else agrees? I believe there were certain different answers earlier. Somebody said chronic hypertension. I would like to know who was it.
No, no, no. What other option like, because we don't know, no, 35 weeks. So here you did not give the history whether she is like
Exactly,
she just like
exactly. That's
uh.
right. I did not say this is new onset, did I? Right?
Yes,
So
yeah, yeah.
that is important. The word new onset is important. It could have been chronic hypertension. Okay, chronic hypertension is also associated with growth restriction,
Gross
is also
restriction.
associated with placental dysfunction. So you do not know at this point. So it is important to note that this has occurred after 20 weeks. So if I give you just this scenario, the differential would be preeclampsia, chronic hypertension. You could rule out chronic hypertension based on history, right?
Mm.
So it has to be new onset.
No.
All right? Okay.
Okay.
Now, there are other things like severe hypertension. What is severe hypertension? There is no longer it is considered as mild, moderate, severe, unlike what was said in the earlier guideline. Now it is severe hypertension and hypertension. Severe hypertension is where the blood pressure is more than 160 or more, and a diastolic is more than 110. All right. Severe preeclampsia is where there is severe hypertension that does not respond to treatment or is associated with ongoing or recurring severe headaches, visual scotomata, nausea, vomiting. These are symptoms of imminent eclampsia, as we say. Okay, epigastric pain, oliguria, severe hypertension, as well as progressive deterioration. So you have to have serial monitoring of the patient. Laboratory blood tests are deteriorating, like rising creatinine, liver transaminases are rising, falling platelet count, fetal growth restriction with abnormal serial Dopplers. That would be severe preeclampsia. All right. So anything that is either the BP is not coming under control or she has symptoms suggestive of imminent eclampsia, in the sense there are symptoms of severe preeclampsia, or there is deteriorating biochemistry, or the fetal condition is deteriorating. So this is an indication that it could be severe preeclampsia. All right. So we are